So, so this is, how about the breast oil?
Okay.
Yes.
So just one comment on this. So if you were going to improve your liver with a formula like this, you do about 50 drops twice a day. You could do like 3 weeks on, 1 week off, and take it forever, or you can do it seasonally. So the liver cleansing time is the spring.
That's right.
So people could be on this for a month or two every spring as their annual liver cleanse.
And you make those yourself?
I provide the recipe, and a company makes it for me,
Okay.
and then it's my label.
So we have the
And
immune power.
Yeah. So the immune power formula is another combination for the immune system, and one of the key herbs is astragalus. So even as women are going through chemotherapy and or radiation, you know, the immune system takes a big beating, and they often will experience fatigue.
That's right.
And so there's certain herbs that are fantastic for increasing energy, stamina, and improving the immune system. Anytime, you can take it anytime, but especially during chemotherapy and radiation. One of those is astragalus, the other one is Photopsis, another one is called ligustrum, and ashwagandha isn't in this one. Ashwagandha would be a good choice too. Let's see, Ganoderma, the reishi mushroom.
Oh yeah.
The reishi mushroom is really important, and another mushroom called Coriolis is really important during chemo and radiation, and another one called Maitake diffraction. So those, they're not all in here. The Ganoderma, the reishi is in here, but not the other two. But commonly I'll give women an assortment of those for chemotherapy and radiation, or just to keep the immune system strong, even if they're not doing chemo or radiation. This is fantastic. And then we have the Healthy Breast formula.
It's right here.
Which is a blood cleansing, lymphatic cleansing breast health formula with red clover and calendula and cleavers and phytolacca and a few other herbs. And phytolacca is probably one of the most important herbs and homeopathic remedies for breast health.
Okay.
In fact, one study at a medical center, the MD Anderson Cancer Clinic in the US. They studied phytolacca and another remedy called carcinosin on breast cancer cells in a laboratory and found that they worked just as well. A homeopathic remedy, diluted hundreds of times, worked just as well as Taxotere, the main chemotherapy drug used for breast cancer. Amazing.
That's exactly.
Yeah, so phytolacca has a strong affinity for the breast.
So those would be the formula that you would recommend?
For most women, either to prevent or after a diagnosis of breast cancer or for recovery. And then I also have an oil, which I'm out of at the moment, called the Healthy Breast Oil. That's a beautiful massage oil for the breast. And it contains certain essential oils. It contains the essential oil palmarosa and lavender and lemon and orange and rosemary and juniper in a base of herbal oils and little frankincense in there, in a base of herbal oils of phytolacca oil, red clover oil, and olive oil. And that topically, we know that the lavender and the citrus oils and the palmarosa oil contain either perolyl alcohol or limonene, which help to kill breast cancer cells. So it not only smells beautiful, but it's anti-cancer by putting it on top of it.
That can replace the perfume as well.
Yeah.
Right?
Yeah.
We talked about that in the
And you know, the
interview.
perfume have phthalates in them,
Yes.
which is amazing. I didn't realize that till kind of recently. So to make a scent stick, they put the phthalates in it, and the phthalate is estrogenic. So you have to, every time you put something on your skin, you're feeding it. It's like a fluid, you know.
Absolutely. Oh my God, there's so much to learn, but still, I mean, it's all about. I mean, your expertise, it's prevention and also treatment
Absolutely.
here in the office.
Yeah.
And I mean, of course, you want to educate people to, you know, with prevention as much as possible.
Yeah.
But sadly, you know, you still have.
I think there needs to be a tremendous amount of money going into education around prevention, particularly educating young women and teenagers.
Instead of research.
Yeah.
Yes.
Yeah. Because we know many of the things that prevent breast cancer. It's not rocket science. We know them, but there's no money in prevention.
Exactly.
The drug company's not going to make money on prevention. You know.
But people are starting to listen now. Like, do you see more? Like 20 years ago, when you start writing your book.
When I started writing my book, I was
You were
alone.
ahead of
I was way ahead of my time, and I was putting together all of the pieces of the jigsaw puzzle and understanding, oh my God, this is what we can do. And it was like a mystery, a great mystery for me. It was very interesting for me to write it because I felt like a detective, figuring out all the pieces that would answer the breast cancer mystery, the problem. And when I wrote this, pesticides were used everywhere. There was not any city that was preventing the use of lawn pesticides. Now there is.
Yeah.
When I wrote this, there was no organic food in the stores. Now there is. Plastic was not considered a problem. Now we're banning plastic bags. So there's been huge strides, and faster each year, thankfully because of the internet and YouTube and things like that, so people are learning a lot faster. So I'm hopeful about the future. I just think we need to be much more mindful of what we do so we don't cause risk.
Conscious, exactly. But you do offer a program for like a breast health program.
Yeah, every year, usually in January, towards the end of January, I offer a Healthy Breast Program teacher training program, usually at the Canadian College of Naturopathic Medicine in Toronto. I also have it available as a correspondence course where people will receive the videos of me teaching, and then they get the manual and they write an exam. And that's with the idea that we'll have many healthy breast educators. That's what I call them. Healthy Breast Program educators that can go out all over the world and take sort of 9 segments to the Healthy Breast Program, dietary, nutritional, spiritual, environmental, hormonal, etc. And they can present those programs in their communities to share that information with other women.
And this is not just for practitioners, it's for
anybody.
Anybody.
Totally anybody. Any woman that wants to educate other women, any woman that wants to talk to her family and friends, as well as medical doctors, naturopathic doctors, nutritionists, massage therapists, acupuncturists, all those sorts of people have taken the course. And now I have them all listed. Once people write the exam, they can be listed on my website, so someone, say, in Nova Scotia could see who's teaching the Healthy Breast Program in Nova Scotia, and we'll create a network of practitioners and teachers.
That's right. So I just have a few questions here. So what would be the best diagnostic tools? I mean, is it mammogram? Is it ultrasound? Is it blood tests? Is it tomography?
That is a difficult question. Okay, so first of all, a woman can get a good breast exam from a clinician, maybe once a year or twice a year. So that would be either a medical doctor skilled in breast exams, or a naturopathic doctor skilled in breast exams with lots of experience. So that's non-invasive and totally fine. I try not to use mammography or recommend mammography unless there's a palpable lump. Because if a woman had, many women used to get mammography every year between age 40 and 50. Thankfully that's not recommended anymore. It's recommended every 2 or 3 years after age 50, which is much better. But some of those women who are recommended to have mammography between age 40 and 50 are the women most vulnerable to breast cancer because their mothers had it or their sisters have it, which is why the mammography is recommended. But the mammography is radiation, and unfortunately radiation is one of the carcinogens that causes breast cancer. And for some people, just a little bit of radiation is too much.
Wow.
So we need other tools. I recommend mammography when it's indicated, but it would be much better to have a different tool than mammography. Thermography is useful as sort of a tool to understand, are my breasts completely healthy or not, so that you can make some changes if they're not. So with thermograms, you get a reading of 1, 2, 3, 4, 5, depending on, or 0. 0 is great, and 1 is fine, and 2 is usually fine, and 3, 4, and 5 there's starting to be some change in the breast tissue that may not be healthy. So you can use everything we've talked about to reverse that. So the breast can easily change from being dense to not dense, from being cystic to not cystic, with a few lifestyle changes and nutritional supplementation.